Okay, we're going to talk a little bit about internal funds, as I mentioned, and I'm going to show you some resources that we've got in the files because, you know, your faculty member is going to have a lot of grants, but they are going to have other sources of support. So we want to have some understanding of what those are so that we can help the faculty member make decisions. So internal funds, again, this is not everything. I'm sure there's a whole 8-session class you could do on internal funds. I'm just giving you the highlights as a research administrator, the kind of stuff that I see. So startup funds, that's the general research support provided when the faculty members first recruited to get their research lab up and running. The expectation is that after a few years, those are going to start to dwindle and they're going to start to be getting those external awards. Academic grant, this is a specific thing for Department of Medicine. So if you're outside DOM, this wouldn't apply, but we do have this fund for certain types of faculty to support particularly PI salary over cap, PI unfunded salary, and research staff salary. So I'm sure you're sensing a theme, and that is salary. And I want to show you saved in the box file. I've got the policy for the academic grant, so you can see exactly what is allowable, what's not allowable. So you can check that out if you are in DOM and you are working on those kinds of funds. Development funds, these are your general research support. They may either be faculty controlled or division controlled, so you want to make sure about that as you're spending them. Gift funds, we talked about, those are contributions coming from donors, but they're not sponsored projects. They don't meet any of those tests, so we have that flexibility. And then endowment funds, this is payouts from endowment revenue that's directed to faculty, and it's encouraged that they spend all those funds in full each fiscal year. So I want to show you there are some resources about that in the internal funds overview that I've got saved in the shared drive. You can see gift funds. We've got information on the infrastructure charges. There is currently an 8%. That's basically an indirect charge for gifts as opposed to one for sponsored projects. So details on that policy are in here. Endowments, a lot of information on endowment policies and procedures on the Fiscal Affairs website. So I've got a link to that here. And then there's an endowment glossary. So if you find yourself coming across endowment terms that you're not familiar with, you can look those up here. Again, Fiscal Affairs is great for spending policies. And I actually saved out here a copy of the School of Medicine Controller prepared financial management insights. This is specifically for how to spend on internal funds, all the policies around that. So I encourage you to check that out. Another thing I want to show you in here, if you're not familiar with the way that funds are named at Stanford, there's a key here that you can use. So you've got your tabs here for non-sponsored and sponsored. So since we've been talking about non-sponsored, we'll quickly look at that. These are the A accounts are your general funds. But what we've been talking about a lot, where we hang out a lot in research administration, are these D accounts, the designated revenue. That's where our startup and development funds are going to be. The gift accounts are starting with G. And then the endowment accounts are starting with a K. Again, there's a lot more to this, but just in research administration world, those are the ones that you see most frequently. Now, where we spend a lot of time is here in the sponsored award range. And so I do want to point those out because people will say to me, Emily, how did you know that was an NIH grant? Well, it starts with a P. If it starts with a P, it's NIH. I know that because of the way that the naming convention is done at Stanford. Other federal sponsors start with an S. When you get down to DOD, those are your T awards. And then you've got your independent foundation awards or university funds are always going to be starting with a U. And then your clinical trials, your industry funded, those are going to start with a V. And then down here, your cost sharing, university research is actually W. So you've got either your cost share, which is supported by university funds, but it's associated with the sponsored project, or you've got your university funded research projects down here in the W range. So this is a useful reference document for kind of understanding what kind of fund you're dealing with. I also saved out here a request template for how do you do a fund transfer if you have to move funds between designated accounts. This is the template. You fill in all the info and you send it to the controller's office. They'll help you out. Okay, so last topic on this section, then we're gonna get into roles and responsibilities, and then we'll get to our breakout rooms. Compliance. Compliance is a massive topic, and I'm definitely not going to be going into every fine detail of compliance, but I do want to show you guys kind of what is the universe of different policies and procedures that govern sponsored research. So First one is the Research Policy Handbook. I mentioned that earlier. This is the comprehensive guide to Stanford's policies around research. It lives on the Do Research website. NIH grants policy statement, we already took a look at. Financial compliance, RMG has a financial compliance page, and it talks about management of expenditures, accelerated and delayed spending, and quarterly review and certification, the eCert, that we're constantly, feels like no sooner have we done eCert than eCert rolls around again. So it is always with us, and there's lots of information on how to do that there. We'll talk about eCert more in a later session. Foreign influence, this is another big one that we'll talk about later, but both Stanford and NIH have recently emphasized the importance of complying with these rules. They're already out there. They've been out there for a while, but there's been some concern that they have not been implemented. So RMG has lots of resources on their website here, Foreign Components Guidance. NIH has their own set of guidance. And I do want to make one point about compliance. When you hear about, okay, the sponsor has a set of guidelines and then Stanford has a set of guidelines, what does that mean? Well, we have to comply with the sponsor's guidance on any of these compliance areas. We have to at least meet the minimum that the sponsor is requiring. And because so much of our work is NIH, that tends to be the gold standard that Stanford goes by. Stanford has the right, and any university has the right to make their compliance more strict. We do not have the right to make it less strict. So we're going to, at bare minimum, we're going to be at NIH level, and sometimes we're going to be even more strict. So that's why it's important to know where RMG's guidance lives, where on the Do Research website, the Research Policy Handbook, that lives, because it may be more detailed and more strict than the NIH. So then I've got a grouping here of kind of scientific compliance around human subjects, animal subjects, and biohazards. All of this stuff, each of them has their own governing panel in Stanford's Research Compliance Office. There's information on e-protocol for each of these. Each one of these has to have an approved protocol before work of that type can be done. So human subjects research, you have to have an approved IRB, Institutional Review Board protocol, before you can begin any human subjects work. And so we've got Stanford's IRB website here, and then NIH policies on human subjects, including the possible exemptions and a decision tree. And really this decision tree is 20 pages long. It's quite an impressive tree available on the NIH website. Animal subjects, APLAC, Administrative Panel on Laboratory Animal Care, is going to give you all the info on that. And then NIH has an Office of Laboratory Animal Welfare. Again, until you have that approved animal subject protocol, you cannot begin any animal work on a grant. Same with biohazards. Again, it's on the e-protocol system. Something that I hear a lot, because in the proposal stage, there is a document called Select Agent Research. And I'll have PIs say to me, am I doing select agents? And I will say, please view the CDC's list of select agents here. And if you see yours there, then yes, you need to have a select agent attachment. So it's very clear exactly what is included. Those are really the scientific ones. Now we get into export controls. This is for anybody who's doing international research. This is actually managed by the chief risk officers, so Stanford takes this pretty seriously. And then we've got another decision tree, because who doesn't love those? A quick guide available on the export control website. Conflict of interest, this has to do with financial conflict of interest. You'll see it on your proposal intake form. If your PI is not compliant, then you send them a little note and say, here's the link to your OPAC's dashboard, check your compliance status, bring yourself into compliance, let us know if you're involved, you have any kind of financial commitment or involvement or board that you're on that might impact how it interacts with your sponsored research. And then down here, the GDPR, General Data Protection Regulation. This is if you're doing research that interacts with the European Economic Area. Again, it's a question on the proposal intake form. If you're not doing international research, don't have to worry about this. But information here, which is managed by the Stanford Privacy Office, is going to help you figure out if your PI needs to be paying attention to that or not. Okay, that is the grand overview of compliance. Definitely more to read on that.